Hello, everyone, and welcome to the new series on emergency medicine. We will be discussing the most common cases which we encounter in emergency medicine, and we will be discussing all the common encounters. So, it will be a short and precise to the point management of different cases in ER. So, today we'll be talking about seizures management. So, let us start the case. So it will be a concise lecture about how to manage seizures in emergency department. Let us talk about the case. The adult, it's an adult. It's not a pediatric case. It's an adult case which presented with the typical tonic-clonic seizures. So if it's presented with the tonic-clonic seizures, and if the bystanders they have performed the first aid and then they brought you to the ER, so how would you manage? So the first step will be always starting with the ABCDs. So the airway, you need to assess and secure the airway. You need to ensure the patient is maintaining its own airway. And if there are any secretions, you need to suction them out and clear the airway because there is risk of aspiration. The next step will be giving the oxygenation. Hypoxia can damage the brain, and if it's less than 95%, you can administer O2 therapy via nasal cannula, or you can give the patient facial mask, but mostly nasal cannula has been given and oxygen has been given through nasal cannula. Next step will be circulation. In circulation, you need to pass an IV cannula. You need to check for the RBS because if the patient is having hypoglycemia, we need to manage it ASAP. So if it is low, you need to give 25% dextrose, 50 to 100 ml IV form. You can give the patient injection vitamin B12 as the patient, if he's an alcoholic, and he can have vitamin B1 thiamine deficiency. You need to give fluids, then you need to send the labs because you don't need to wait for the seizures to stop and send the labs. You need to send the labs at once. So now coming to the lecture based on selecting the appropriate anti-seizures medication. So first of all, no matter how you can give, depending on the institution, which one you use, you need to give diazepam. Diazepam 5 mg, which is diluted in 8 ml, 0.9% normal saline. You need to give over 5 minutes, and then you need to repeat it again. You can give again 5 mg. If it's still not controlled, you can give 10 mg until 20 mg. Maximum dose of 20 mg has been given. Let's suppose you have tried this one and you failed. Then if it's still not controlled, you can give safely phenytoin with the dose of 15 mg per kg over 15 to 20 minutes over infusion. So once the infusion has been stopped but still the seizures are continuing, you can repeat the dose again with the same medication, phenytoin, with the same dose. Now let's suppose phenytoin didn't stop the seizures. So what can you do? You can select another anticonvulsant like injection levetiracetam with a dose of 30 to 60 mg per kg over 15 to 20 minute infusion. You can infuse this patient with this. If your institution goes towards sodium valproate, you can give it a dose of 30 mg kg per over 15 minutes. And let's suppose you have been tried this and still you failed, still not controlled. Then you can give the patient phenobarbital 20 mg per kg diluted in 100 ml normal saline IV, because this will be, once again, phenobarbital will be our choices after the mentioned medications. Let's suppose then the patient still fail, so we need to call the general anesthesia if the patient, because the patient might need a ventilator assistance, and mostly they give injection midazolam, propofol, and then they repeat the doses of phenobarbital. So this is a short overview over how to treat seizures if you are faced with such a case. And then you need to, if the patient stops seizing, you need to monitor the GCS scale, pupil reflexes, trying to find the underlying cause, manage it up, because from the labs you can find any electrolyte abnormality or hypoglycemia, hypoxia. And once patient seizures are controlled, you can do the CT, brain MRI for the insult, as most likely the status epilepticus mostly have the acute brain insult. You can do the EEG to find the causes. So this was a short case on how to manage seizures in emergency medicine. I hope it have cleared your concepts, and please stay tuned for upcoming lectures on emergency medicine cases, common cases. Thank you for watching. Please like and subscribe my channel.